Now I will talk on cemented and cementless THR. Modern day hip replacements began in the 1960s with the implants fixed with the acrylic cement. That was the only method of fixation until the 1980s when surgeon began sticking metallic beads on the osteotomous stem from which the uncemented stem was born. Since then, surgeons in North America, Asia, Australia have overwhelmingly favored uncemented fixation, while Europeans have preferred cemented components. Cemented fixation in Sweden is more common than in other Scandinavian countries. Poor results with uncemented fixation during 1990s resulted in totally cemented fixation reaching peak of 90 to 93% during 98-2000. A review of current fixation use and registry outcomes in totally arthroplasty. Now, increasing use of uncemented fixation in total hip replacement is a worldwide phenomenon. An assessment of registry data from 7 countries with a minimum of follow-up of 5 years identified that the use of uncemented implants recently has increased in most countries. Prospective studies have shown greater than 90% survivorship into the third decade with many different uncemented stems. Survivorship analysis of the femoral component with a revision for aseptic loosening as the endpoint was 99% at 26 years. It was published in Orthopedics 2010. Survivorship at 22 years with a revision of the femoral component for any reason as the endpoint was 86%. Survival for femoral revision for aseptic loosening as the endpoint was 93% at 22 years. Long-term results of an uncemented tapered titanium femoral component and factors affecting survivorship was published in CORR 2013. Cemented stems. 2 similar studies demonstrated high rates of long-term survivorship among 2 cemented stems, Charles and exterior stems. 25-year rates of survivorship free of reoperation, free of revision or removal of the implant for any reason, and free of revision or removal for aseptic loosening were 77.5%, 80.9%, 86.5% respectively at 25 years. With the endpoint reoperation for aseptic stem loosening, the survivorship is 93.5%. The reoperation rate for aseptic femoral component loosening is 3.23% into 33rd year follow-up. Older patients. A aforementioned registered study concluded that in older patients, defined variably as those older than 65 or 75 years of age, the risk of revision rose significantly with the use of uncemented and hybrid components. Age older than 75 years in 3 registries, cemented fixation was associated with a lower risk of revision than was uncemented fixation. In younger patients, the risk of revision difference was either not significant or favored the uncemented implants over the cemented and hybrid fixation. A registered study of combined Nordic database of 4 nations. Similar findings have been shown in a review of the combined Nordic hip registries. Still, despite the fact that registries periodically update surgeons with the information that cemented implants in the elderly population perform better, surgeons have increasingly used uncemented implants. Coming to the skill, yes, it matters. Poorer reported outcomes with the cemented implants in Australia may be attributed to the fact that surgeons there are less experienced and therefore less skilled with the cementing techniques. Similar surgeon experience and skill deficits may explain the poorer outcomes with the uncemented stems in Europe. Cost savings of using a cemented total hip replacement. An analysis of the National Joint Registry data. There is a conflicting evidence as to whether either cemented or cementless fixation is more cost effective per case. Hybrid total hip replacement. An assessment of data from English and Welsh Joint Registry showed that for most patient groups, hybrid total hip replacement offered the most cost-effective lifetime outcomes. The CPT trilogy is the most cost-effective with an incremental net monetary benefit of 876 pounds. Quality of life after total hip arthroplasty rather than the risk of revision was the main driver of cost effectiveness. Conclusion: there is a wide geographic variation in the type hip component fixation, but the use of uncemented implants is on the rise despite evidence of worse survivorship in elderly patients. With either fixation type, proper training and technique of implantation will optimize outcome scores. Neither one stem nor one fixation type fits all, and surgeons must choose implants according to bone morphology, patient age, and personal experience and skill.